All right, should we go ahead and get started?
All right.
Absolutely.
Great. So thank you so much for being here for this panel. I'm Susan Donley. I'm the publisher and CEO of Stria News. We're trade media for people who work in aging and the longevity market. And I'm excited to have the opportunity to moderate this panel. One of the things that we try and do at Stria through our reporting and content is think about cross-sector solutions for our aging society. And this topic on the intersection of housing and healthcare really fits the bill. And of course, I have an incredible panel of folks to have that discussion with all of you today. So I can recognize some faces around the room, so I know that you are a well-educated group of folks. So I won't spend too much time doing preamble, but just to do a little bit of stage setting. I think we all know that as more and more people are growing older, we are going to need more and more solutions for both housing and healthcare. And today we're going to talk about how those intersect and why that's necessary. I'll just share a couple facts. We know that 76% of older folks, people over 50, according to AARP, want to age at home. But we also know that over half of middle-income seniors won't be able to afford housing or care. So whether it's for preference or financial reasons, folks are going to be aging in community and they're going to need increasing amounts of care. So the folks at Milken in their AgeForward 2030 report identified housing, affordable housing and integrated care solutions as two of the top priorities for local communities excuse me, when thinking about solutions for to enact by 2030. So we're going to take a little bit of time and talk about some of that. So I'm going to introduce the panel and start with a question for each of them. Then we'll do a little bit of discussion. But then we're going to save time at the end for questions from all of you. So as you're listening, if you think of a question, jot it down or save it. We're definitely going to come around and have you part of the conversation. Okay, so I'm going to start at the far end. This is Dr. Christopher Herbert, who is the managing, I'm going to read these so that I don't get any of these really good folks' bios wrong. So Chris is the managing director of Harvard's Joint Center for Housing Studies, which engages in research, education, and public programs to advance understanding of housing issues. The center is most famous for its reports, and one that's very relevant to this conversation, Housing America's Older Adults, just came out last week.
A week and a half ago.
A week and a half ago. So Chris, I wonder if you can get us started by just sort of taking the broadest view and talking about why secure and affordable housing is a critical component to healthy aging.
Sure, absolutely. It's great to be here. Thanks to the Milken Institute for inviting me. I do feel a little bit like a fish out of water sometimes at this conference because I'm a housing person among a lot of healthcare people. And so I hope that healthcare people don't take umbrage when I say that housing really is the linchpin to well-being in older age. And it's the linchpin for a host of reasons. You mentioned stable and affordable. I mean, certainly stable and secure. I mean, having a house, a roof over your head is enormously important. Just the correlation or the association between being homeless or being unstably housed, insecurely housed, and a whole host of health issues is just enormous. I don't think folks in this panel could talk more about that than I can. So leaving that aside, you mentioned affordability. Affordability is so important because Matt Desmond in his book Evicted came up with the phrase, the rent eats first. And the truth is you have to have a roof over your head, and whether it's the rent or in this case I'd also add the mortgage check, you've got to pay that bill at the beginning of the month. And if after you pay that bill, there's not enough left over for everything else, something has to give. And at the Joint Center, when we look at what gives when people spend more than half of their income on housing, and there are about 5 million elderly households spending more than 50% of their income on housing, both homeowners and renters, what they first cut back on is food. So we see that an enormous reduction in the amount people spend on food each month when they're paying too much for housing. And the second thing they cut back on is healthcare. And so when you talk about housing affordability, you're talking about housing insecurity, you're talking about healthcare insecurity. But beyond the stable, secure housing and affordability, I think the other aspects are the physical house itself and the location of the house that are so important. And just briefly, certainly the accessibility of the house, whether the house accommodates people who have mobility disabilities or other limitations in their physical functioning. If the house doesn't accommodate those, if there are stairs you have to climb or rugs you might trip on or other aspects that make you at risk of a fall, you're at a great risk of all the repercussions of falls late in life. The second thing I would point to is, and Mike Milken was talking about this today, the issue of isolation and loneliness. And so 80% of older Americans live in single-family houses. So they're mostly in low-density areas. And by the time you're 80, the risk of not driving starts to rise significantly. And so we have a lot of people in housing that by its definition keeps them socially isolated. And the association between social isolation, loneliness, and dementia and other health problems is also quite clear. And then lastly is the question of whether or not the house is integrated with healthcare services delivery or not. Again, being in low density single family houses, the challenge for the healthcare system is how do we integrate services into the home? There's certainly a whole host of housing options, assisted living, continuing care, retirement communities, and other things in between that are designed to provide that integration. And certainly that's an important option we have to think about as well as how do we bring healthcare services into the home. So you have affordability, accessibility, social connection, and access to healthcare. Housing really is the linchpin to well-being.
Great. Well, that was a very broad strokes intro, and you teed up Gretchen, who is just to my left, and I'll introduce you first. Gretchen Alkema is the Vice President of Policy and Communications at the SCAN Foundation, where she oversees communications and policy strategy. And I know Gretchen for a few years now, and she is sort of my go-to person on policy around healthcare and long-term care. So Gretchen, I wonder if you can sort of take from Chris's comments about integrated housing and tell us about some of the innovative strategies you've seen sort of on the ground when it comes to policies and programs that provide that integrated housing or healthcare.
Certainly. Thank you so much, and it's a pleasure to be here with this great panel. When I think about housing security, it's both in terms of how do people live in the housing stock that they have, how do they be able to maintain their health and functioning within that housing stock and not lose it because of all the costs that you just articulated, as well as for people who are really on the edges when their functioning changes, how do they return to that housing in a way that's meaningful for them? We see people who may have a stroke, may have other functional decline, and they can't actually return to the housing that they have available to them because of stairs, visibility issues. So thinking about what are those interventions that can help people be able to maintain solidly in their housing if they have it, as well as the affordability in their neighborhood if something changes with their own economics, which can be really critical. But housing is a local issue, right? It's like the ultimate local issue. It's local for the person, but it's also local in terms of things like zoning policy. Cities have a lot of control over that, so I was really excited to see the emphasis on housing in the report, and then the connectivity about how do you bring in care in a way that's meaningful to people, whether it be bringing healthcare workers into the home or people being part of neighborhoods that have healthcare access available to them. I live in a place where there's a sprawling suburban communities all over the place that were built up in the 80s, and I think about how far away some of those healthcare services are for people to be able to live in a place that they get access to care in a meaningful way. Those are challenges that we need to face. And I look forward in a little bit later to talk about some of the state level opportunities, but I'd love to hear from some of my colleagues first.
Great, that's great. And so, I'd love to just touch on some of the folks who maybe don't have a home to come back to, whether they can or not, and bring Dr. Bashara Sukkar. Shukar. I practice too. Dr. Shukar is Senior Vice President and Chief Community Health Officer at Kaiser Permanente, where he oversees national community health efforts and philanthropic giving. And Bashara, I wanted to ask you sort of how does the equation change from what we've talked about so far when we're talking about low income folks or those experiencing homelessness?
Yeah, first of all, thank you for inviting me to be here on the stage with this wonderful panel. And I want to start by what we learned from a recent survey that we've commissioned probably a few months ago, when we've taken a representative sample of people living in this country across all different socioeconomic classes, and we've asked them, have they had an unmet social need? And we particularly focused on those social needs that are health related. So we've asked, do you have housing stability issues, food security issues, transportation issues? We've asked about social isolation, all 4 points you've raised. And we've asked about the ability to pay your bills. And what we've learned is that 68% of people living in this country have had at least one unmet social need. 68%. And when we've asked further, is this unmet social need a barrier to health? 1 in 4 Americans said yes, it is. So 1 in 4 people in this country have to make a choice every month between paying their rent or paying their copay to get their medication, between buying food or meeting their deductible for their health plan. So those are real issues. And when we start thinking about health, we have to be thinking about not just the physical health and the mental health of people. We really have to be thinking about the social health of folks. And that includes a key aspect, which is around housing. And I'm a family physician. I trained in a healthcare for the homeless program, and I've worked with people who are on the streets for most of my clinical career. And what I've learned in that space is that housing and health are so interconnected. And now we have tons and tons of research and evidence that proves that. We know that if you're homeless and you're living on the streets and you end up being admitted to the hospital, chances are you're going to stay 2 to 3 days longer in the hospital. We know that if you're discharged from the hospital, your chances of being readmitted are 50% higher if you're homeless. We also know that your mortality rate if you're homeless is 3 to 4 times that those who are not homeless. We know your total cost of care is 3 to 4 times higher than if you're housed. And we know that your life expectancy is 27 years less if you're homeless than if you're housed. So the interconnectedness between housing and health is so critical, and I'm so glad to be sharing the panel with this group and looking forward to the conversation.
That's great. There's so much to unpack in that, and I hope we get to it in the discussion. But first, I want to introduce our final panelist. Tama Davide is principal with Gensler, a global design firm, and her work extends across the globe and includes a diverse range of projects from hospitals and community health centers to buildings and campuses designed to support longevity. So Tama, I'd love to just hear from you a little bit about how the sort of physical space, how the design, what role it plays in integrated health and housing.
Great, thank you, and it's wonderful to be here with this panel, and maybe you feel like a fish out of water, and I think sometimes design's voice isn't necessarily heard at panels like this, so we're really honored to have that opportunity. So as a global design firm, we literally impact human lives across the globe in the communities in which we live, work, and play. And we believe design has this power to positively impact human interaction, and it impacts immensely human health as well. I wanted to talk a bit about kind of my upbringing. I grew up in West Hope, North Dakota, a town of 500, a small little teeny town. And many of the homes that people grew up in were the homes that they were born in. They lived in these homes their whole life. We had doctors that came to our homes, and many people lived in intergenerational homes in their houses, and families cared for them. And the life expectancy in the little town that I grew up is the national average. And many of us have talked about where we live and how the impact of city has on our life expectancy. Not only homelessness, but your zip code most likely depends on your life expectancy more than perhaps your DNA. So we really understand how designing cities is a really critical aspect of that. And one aspect I wanted to really talk about was about zip code health. And you talked about health in terms of its mental, physical, and social well-being. And we believe designing cities and its integration of that is important. So in New Orleans, you can live 25 years longer just by growing up in the neighborhood next door. So it's important, right? The design of cities and that impact. And I wanted to talk a bit about how we're partnering with healthcare providers around the country, really focusing on bringing healthcare services into neighborhoods that have the least amount of healthcare access. And we're working really closely in cities like Detroit and Chicago and New York and Los Angeles, really impacting design and bringing health into these disadvantaged communities. Here locally in Washington, D.C., I'm really involved with an organization called Unity Healthcare. It's a federally qualified health center, and it provides care for 1 out of 5 district residents. And they're really focused on delivering this model of a personal home, a primary care, behavioral health, and dental care, all a medical home model to all of the patients that they serve. And the recent facility that we completed with them was really quite unique. They co-located in a building that had affordable housing, it has job training, and it has a clinic, a federally qualified clinic. And really we see this movement in design of buildings in cities and in neighborhoods where these services are co-located together to really impact human lives in meaningful ways. They tried to get a PACE program in that building as well, but because of governmental tape, they weren't able to bring in an inclusivity program for the elderly. But we see this as well. Oak Street Health is really focusing on adult care for Medicaid patients. We see retail health going into CVS and Target. We see urgent care everywhere in almost every block in the cities. The VA has mobile module units that travel into cities and neighborhoods to deliver care exclusively. And we see mobile devices, AI, and big data really driving healthcare in meaningful ways. And even physicians that are providing and writing prescriptions to go for a walk in the park, because we know that that really truly impacts our human health. And yet as we look forward, we believe healthcare is going to be provided mostly in our homes. Mm-hmm. So how can we prepare for that? You all have this on your chair, but I wanted to talk a bit about some of the impact and thinking that we've done with the Milken Institute around design and design of cities, and I'll mention just a couple that are in this book. The design interventions such as new urbanism, really looking at ways to develop mixed-use areas in cities and to build density and to really have vibrant communities in these cities that we live. And as you all probably know, more people live in a city today than ever on the planet. And another one really talking about complete streets, about the design of streets that support all types of vehicles and modalities of movement, maybe even scooters, not just the two-wheeled ones, but the four-wheeled ones that we might all be in one day, and really designing spaces that integrate the grand idea of transportation where there were trees and parks, and it was a lovely thing to move, not just sitting in your car driving for hours and hours, getting from point A to point B. So I guess I really want to just end this little opening piece by saying, design is a part of everything. Each one of our panelists has talked about the design of integration of micro elements to macro elements, and it's really an honor to be on this panel.
Thank you. That's great. So let's get into it. So the first thing I want to dig into that really you all touched on is the idea of equity and the role that it plays when we're thinking about sort of systems and models and opportunities to provide integrated healthcare and housing. And so I wonder if you can each just talk a little bit about the importance of equity in these issues in general and how you see those sort of in your own work. Mm-hmm. Whoever can jump in.
Please.
So on the report we just put out that you mentioned, Housing America's Older Adults, the headline was about the growing inequality among older adults. And it reflected in a variety of domains. One is income trends. If you look at older adults at the top end of the income distribution, their incomes have been rising, where those at the bottom have basically been flat or falling. If you look at differences in home ownership rates, they're widening between whites and people of color. And if you look at wealth, which is again related back to home ownership rates, there's an enormous difference between homeowners and renters. The typical homeowner, even at the bottom of the income distribution, will have $100,000 or $200,000 in net wealth. That is typically what you draw on late in life to pay for these services. But if you look at the typical renter, they have only a few $1,000s, not enough to even pay for a month of care. And so certainly at the bottom of the income distribution, there's an enormous lack of resources to be able to pay for the kind of services that people need, absent becoming, going into nursing care through Medicaid or being able to take advantage of some of these waivers. But Bob Kramer's in the audience. Nick has sponsored a report that showed not just at the bottom, but the middle of the income distribution has enormous consequences looking forward to what it's going to cost to provide care for that group and what resources they have. So there are enormous equities, not just at the bottom, but also in the middle of the income distribution as well. Because our system really requires, for the most part, people to pay on their own. And so that historical legacy of inequities that have been built up to the time you're an older person really come to the fore at that point of life.
Yeah, I was struck by that report, that Nick report about middle income seniors, because we do talk a lot amongst ourselves about lower income, sort of very low income folks, and how do we, they're not quite qualifying for Medicaid, but it was really an eye opener to see what an enormous chunk of that middle income older folks are really going to be in a pinch.
Well, and that's where I was going to go too, in terms of particularly the NIC report and all the analysis that the NORC team did for that is, we talk so much about lower income individuals or folks who have no income at all, much relative to the homelessness population, and how critical that is. Upper income folks, they can very much take care of themselves, and they do their own things to integrate health and housing in all sorts of ways. But it's that middle income group that is looking for solutions, utilizing their resources to be able to stay in home and community. I suspect nobody woke up this morning saying, God, I can't wait to go to the hospital or the nursing home, and I want to stay there forever. And so, this is all of us thinking about what are those resources that I use to connect health and housing in meaningful ways so that I can live well in the place that I call home, and that may change. Home isn't always the place where people grew up or that they raise their kids. It's that place that is meaningful for them to live, and that might be with a loved one, that in terms of a daughter or another family member. That might be in assisted living, but to do that still generally takes resources, and middle income folks are trying to figure out how do they preserve that nest egg in a way that can meet the needs that they have for the long haul. And the last thing I'll say on this is, I worked with older adults for a really long time and did it as a social worker for many years before my current role. And it was always amazing to me how folks had resources to bear, even if it was a small pot, but they wouldn't spend them, because it was that nest egg thought of, I can't let this go because I got to wait for the rainy day. And I would look at them and think, my God, it's pouring in your life today. What happens if you spend a little bit of your resource to be able to maintain that place called home, to manage your health in the best way possible? And that's not generally what would happen. Most of the time, something catastrophic would happen to them. They'd spend out their resources in really inefficient ways and end up in places where they didn't want to live. And so how do we just change that mindset around to connect health and housing a little bit better upstream so people can stay continuously in the place that is meaningful to them?
I'm happy to try here and answer this really important question. I think, at Kaiser Permanente, we've been on a journey of looking at where we're seeing inequalities or inequities or disparities in our healthcare outcomes, and we've been on a very focused journey to close those gaps. And we've done a really good job at eliminating much of the disparities that we're seeing on things like colorectal cancer screening, blood pressure control, flu vaccine rates, and other metrics. And I think as we start lifting up our work on social health, we're seeing similar inequities in the system. And our focus and our role is to do that same, bring that same rigor in thinking thinking about disparities and inequities that we've done on the physical health side to bring it to the social health side, whether it's supporting people getting enrolled in food stamps or supporting people connected to housing agencies or dealing with social isolation. Those are important things as we think about the social needs of our members. But make no mistake, at the end of the day, to be able to address inequities head on, we really have to be thinking about policy change. Otherwise, we won't be able to make a difference at scale. It's important to pay attention to the individual, and it's really important to address broader issues that we as a country have created. Inequities didn't come up overnight. It's our policies, our redlining policies, our structural racism and other issues that brought these inequities to this country. And without addressing those, it's really, really hard to make a dent on inequities in this country.
Yeah, that's such a great point, and I want to talk about policy and sort of systems change. Before we leave the topic of inequity, I wonder, Tama, if you have any thoughts about the role of gentrification in sort of this whole picture.
Sure. I think probably when we think of gentrification, maybe the first motion that we have is that it's negative, and it's all negative, that people are having to move and being displaced. And yes, I think in some cases that does happen. But I think gentrification does have an opportunity as well to build healthier communities around existing cultural aspects, and really looking at how can gentrification be seen as a positive in a neighborhood where you engage the community and you have conversations of keeping people in their homes. In many parts of the country, people are committed to the culture of the neighborhoods that they grew up in, and they're very unique, and they want to keep that cultural aspect. So there's a great opportunity to have these neighborhoods be very unique, and have gentrification bring up some of the places that no longer exist or haven't been maintained in the way that they have. So I think it has a positive option and an opportunity to really intentionally look at development and gentrification in meaningful ways, and not just kind of take over neighborhoods and say, oh, it's just for the millennials now, when in fact we know that intergenerational living really supports all ages and improves the health of all of us in those neighborhoods as well.
That's great, and leads me right into our next topic, which are some of the models that you all are seeing working. And I don't know, Tama, if you want to just continue,
Sure.
If you have other thoughts or additional thoughts about intergenerational housing.
Well, I'd love to, talk more about this little booklet that you have on your chair.
tease you up for
I'm
it.
going to toot the horn. But, we have two case studies in here where we worked with two neighborhoods, one in Washington, D.C. and one in L.A., to really look at, okay, here is a part of the city that needs some help, that needs some assistance. So what can we do to design a place that really focuses on intergenerational? We did research on a topic that we call Boomtown, and Laura, I'm going to give you credit. You came up with that. She works for the Gensler Research Institute, and we really looked at what would keep, we said 50-year-olds, yes, of course, 60 and 70 and 80, but how do we want to live, and where do we want to live? And many of you have already mentioned the things that are critical: this physical architectural piece, the social architectural piece, and then obviously policy, and how those things all work together to really create meaningful living environments. And through that research, we really learned that it's really by living intergenerationally. If you think of little old cities, like the little one I grew up in, well, it was intergenerational. Of course it was, because everybody was still living there. Your grandmother, your mother, your child, the children, the nieces, the nephews. You got together and it felt like a community. And now we see that this intergenerational living supports new types of families. You're not necessarily with like a blood family member, but you're with like someone that you care even as close to your family, like Friendsgiving, it's a thing, right? It's important to gather these things together, and all of these pieces really work together to support that.
Yeah, that's a great example, and maybe I'll share some of the learnings that we've had from a work that we've been doing in Oakland over the last year. So we've, many of you know Oakland is our home as an organization, and yet we've realized a significant uptick in number of people on the streets in Oakland over the last few years, particularly aging population. And when you think about being on the street, really 50 is the new 75. So when we started looking at who are the homeless individuals who are on the streets in Oakland who have one or more medical problems, we found that there are 515 people that we actually got to know by name. So we literally developed a by name list of those 515 people, and we've partnered with community-based organization, and we challenged our system and said, what would it take to get those 515 people off the street and get them into stable housing? And it was a big challenge because a lot of folks said this type of work might not work. There's all this bureaucracy. There's all these barriers you have to bypass. And we're like, let's roll up our sleeve and see, can we get 515 people that we know by name off the streets and get them into stable housing? And guess what? In 8 months, we were able to get 515 people off the streets into stable housing. And what we've learned throughout this process is it's not just about getting people into permanent supportive housing. Yes, permanent supportive housing is the gold standard. It's fantastic, it's great. And it's not enough, and we don't have enough permanent supportive housing. So the concept of shared housing has been really popular with that cohort of 515 people. And now, actually, almost 70% of the folks who now have signed leases of places to live, places that they can afford based on their SSI income or whatever type of income, they're living in shared housing. And I'll end by sharing an anecdote of a 72-year-old man who's been on the street for 20 plus years, finally housed. I had breakfast with him a few months back, and I was talking to him about, how is it to live on the street for 20 plus years? And he looked at me and he said, look, living on the streets is very dangerous, and it was scary. But you know what? Homelessness was not gonna kill me. What's gonna kill me is the fact that I'm feeling lonely. And I think as we think about social isolation, particularly in the subgroup of subpopulation, it's so critical. So having innovative models, whether it's intergenerational housing, shared housing, is really critical to address the housing issue, but also address the social isolation issue.
You have a great job. That sounds wonderful. Other models that you've seen that are promising?
I think the models, so much of the work that we've been supporting in different ways over the years is about how do you help with that transition at times when people have had a critical health event, and the complexity of that health event when they've had unstable housing. Some of it is on and off homelessness, and we've worked with folks like the Institute on Aging, also in Alameda County, that have looked at what are transitional spaces that they can provide in partnership with different health systems to help people be able to move off of the street and not be stuck in hospitals. I mean, that concerning number that you talked about of 2 to 3 additional days, that's certainly concerning from a cost perspective. I actually think it's really concerning from a health perspective. I mean, hospitals are not necessarily the safest places for folks to be, particularly those who have chronic complex conditions. And so all the variety of things that we're seeing that bundle healthcare and housing in ways in those moments of time that really matter for folks creates opportunities for really new vibrancy in how to meet people's direct needs.
I bring it back to the report a bit. In the report, there's several recommendations around the built environment. A lot of them have to do with new forms of housing. One of them is multi-generational. The other has to do with mixed-use developments that are transit-oriented and walkable communities, the kind of new urbanism that Tama was talking about. And I think, as we think about what are the models we need, it's important to bear in mind that we've already talked about the fact that this older population is incredibly diverse. And it's also enormous. I mean, it is, if you look at the number of households that are going to be headed by somebody over the age of 80, it's going to go from about 7 million today to about 16 or 17 million in the next 20 years. That's an enormous number. And so how are we going to house those folks? In a whole host of ways. And I think people might say multi-generational housing, co-housing, that's a niche product. It probably is. But you know what? It's going to be a pretty darn big niche. If only 1% of those people, of older people, opt for it, that's a big number. And the people who are going to opt for it will be intentional communities of people who that appeal to that and who need that. There's a whole host of other, we talked about mixed-use developments. There's a big push now towards accessory dwelling units. So I think, Oregon has now eliminated single-family zoning at the state level in larger municipalities. Minneapolis is doing away with it. California is pushing that way. I mean, we have to make better use, to Tama's point about the design environment, better use of the built environment we have. We talk about aging in place. I mean, people want to age in a home, in community, and we need to expand the range of options to stay in community. And some of that's going to be new, denser development. Some of it's going to be granny flats, where either the granny will move in or the kids will move in to be near granny. So I think there's a whole host of models that are going to look at different people in different circumstances. And so let 1,000 flowers bloom.
May I add one other?
Yes,
I just heard of this. So Mary's Housing here in the DC area is really seeing that there's an increase in homeless LGBTQ young children, adults, or adolescents, anything between the ages of really 15 and 20. And they're looking at the loneliness in the LGBTQ seniors who have homes, probably are living alone, and they're looking at a model to co-locate and bring the young and the elderly together, but teaching the youngster, if you will, to be a care provider, so that not only can they live in the house, but they can actually provide some sort of a source of income and some sort of a source of training. And I thought it was really a beautiful mix of like social and equity and bringing people together and educating, and a really lovely model.
Yeah, I love how specific that is to just one very specific set of folks here in DC. And I think that one of the mistakes that we often make, those of us who work to support older people, is sort of lumping them into, I mean, when you think about 50 plus, it's crazy. I mean, there's such diversity. So I think the many flowers bloom is a good point. Okay, so now let's move into systems and policy. So I'm quite curious to hear from you all about who you really think is primarily responsible for this work. So we talked about housing as sort of the ultimate local. So does that mean that local government bears this burden, or is it a mix, or how do we get there in terms of policy, and whose door should we all be knocking on?
So I'll just say yes. It's many actors in this process, and one of the things that we've been excited to do at the SCAN Foundation in deep partnership with the Gary and Mary West Foundation, the Artstone Foundation, and others in California is really move forward a conversation about a master plan for aging at the state. California has, like many states, thinks about aging policy, or at least historically has, in terms of a budget cycle that was focused on Medicaid dollars in the health realm. Housing was divorced from that conversation. Transportation was divorced from that conversation, as well as many other aspects of things that the government at the state level has connectivity and touch to. And so ourselves and our partner foundations have been pushing forward for this concept, and very excitedly, in June, Governor Newsom, a new governor, I think that matters, took on the charge of an executive order of saying that California is going to have a master plan for aging across the state. And with that, brought forth many different entities inside of his cabinet to be the creator of that, with support from many stakeholder advisory groups. And I say all of this in the context of health and housing, is that housing is at the table, and transportation is at the table, and all of the healthcare entities that have the connectivity at the state level are at the table, as well as many others. And that's the first place to push forward in terms of how do we think about aging as that system, and the policy interconnectivities, whether it be allowing for different kinds of housing beyond the single family unit and a plot, to how do you create development zones that has support and remove policy barriers at the state, to making sure that it's connected to transportation lines and other development systems that are happening in communities. So the report, the master plan, is due on October of 2020. So we'll look forward to seeing where that goes. But the reason why we push so hard for this is that leading states to address all sorts of long-term services and supports policy in their state, all of those had a master plan for aging. They called it different things, but they ultimately had a North Star that said, we care about our aging community at the state level, and then the trickle effects to the cities, to the counties, to the other municipal districts that have so much jurisdiction over this in many, many ways. And so we look forward at that system transformation happening at the top overall, but creating enough room for there to be that thousand flowers blooming at the city and local level.
I think from my perspective, completely agree with the importance of focusing on state, and it's really important also to focus on what policy can happen at a local level, what policy can happen at a state level, what is the role that the federal government has to play. At a local level, I would like to highlight the work that City Health is doing across the country. City Health is an initiative of the Beaumont Foundation and Kaiser Permanente, and we're working with the 40 largest cities in the country to try to figure out what would it take to adopt 9 evidence-based policies that would advance community health. One of those policies is around inclusionary zoning. So we're providing technical assistance and supports to cities to adopt those levels of those types of policies. Same things, we're working in multiple states on different initiatives that address housing issues. And on a federal level, I do want to highlight a coalition called Mayors and CEOs for U.S. Housing Investment. This is a coalition of 24 bipartisan mayors from across the country and CEOs from across the country that came together and identified a list of policy changes that we would like to see at a federal level to double down on investing in housing, particularly affordable housing. And we are the national sponsor of this coalition. Some of these policy focus that we've been narrowing on is including when there's going to be an infrastructure bill, we'd want to make sure affordable housing is an integral part of that infrastructure bill. We'd want to look at programs that we know work, like the veteran vouchers and other types of vouchers that we know work, and double down on those as opposed to pedaling back from those. We're also calling for the creation of a flexible fund that would prevent people from getting on the streets from the get-go. Because a lot of time, really, all it takes is just one time for you to miss your rent, and then you end up on the street, or that 1 month where you can't make it. So I think the policy work really needs to happen at all different levels, and the private, for-profit and not-for-profit sector really has to roll up their sleeves and work on all these different levels to make a difference.
Mm-hmm. Maybe I'll just add that, all of us individually have a role in this perhaps as well. Many of you are very involved in the village movement, and it's really neighbors helping neighbors. So sometimes the government can't fix it all, and sometimes you just need to knock on the door of your neighbor who is having trouble getting out of his car or getting out of his house and say, hey, I live right next to you. What can I do to make your life living here just a little more friendly?
I don't know that I have much to add. I do think Gretchen hit it on the head when she said, yes, it's all levels of government. I think, the conversation we were having earlier, thinking about the forms of housing, and Gretchen, you said earlier, it all comes back to local. And locally, it does. It comes down to land use, building codes, and the like, about whether or not we enable these new forms of housing and whether we enable them in all the places that we need it. It also does come back to cost. And one of the big barriers here is how expensive it is, and how it is providing affordable housing. We haven't talked a lot about people at the bottom of the income distribution needing rent subsidies. Enormous growth coming in the numbers of very low income older renters. And what does that imply about our housing subsidy system and whether or not we're supporting that adequately? We haven't talked a lot about the need to retrofit the existing stock. But again, lots of people who don't necessarily have the resources to make their homes more accessible. And there's a role for the federal government in paying for these kind of, helping support these bigger ticket items. And what I think we really would hope to see is a coordination across all these three levels of government. And local governments are really where the rubber meets the road, and both in terms of making sure that these types of housing are available, resources are well used, and that the needs of their community are adequately represented. So I do think there's a special place for local governments, but we do need federal and state governments to be supporting them, and particularly when it comes to the amount of money that's going to be needed to address these issues.
Some of the early data that came out from the first Master Plan on Aging meeting in California was about the housing crisis in California, which is extensive. I'm sure it's true in other states, but it was amazing to see that data from the Department of Finance. And it basically spoke to the idea that there was, some X large number of units that if we built that amount every single day for the next 20 years, we still wouldn't actually meet the capacity of just the residents of California and their housing needs, regardless of whether they could afford it or not. So there's so many variables in this. I think a lot about how do we help people who have a place to be, remain well in that place that they can be through things, through accessibility pathways, through modest renovations, as well as how do we think about building up enough units that actually allow for people to live in them in some kind of space that meets their needs.
So what I'm hearing is we need a lot of everything. So I'm going to go to audience questions in 1 minute, so get yours ready. But I want to ask the panel, I want to nail you all down a little. So if you could think of 1 or 2 community features that you hope to see by, we'll use 2030, to align with the AgeForward 2030 report from the folks at Milken, just sort of what is the 1 or maybe 2 community features that you really hope that we're seeing when we meet that horizon? Any order?
I'll go. I was in an earlier discussion here in this room around addiction and stigma. And it really touched me in a meaningful way. And I thought, seniors and elderly have the same issue with stigma. And I guess if I had one thing I would change in communities, it would really be about changing perception and attitude, about accepting the aging process and welcoming people of all types of ages into our social circles and engaging and really focusing on removing the stigma on aging.
So you went big. I'll go really micro to counteract that, and then you guys can land maybe somewhere in the middle.
Okay.
How does that sound?
Sounds good.
So I would love to see Sarah Zanton's model out of Johns Hopkins University called Capable. If anybody knows about Capable, I'd love to see Capable spread all the way across the United States and embedded in every health system as part of the Medicare Advantage supplemental benefits for those who have complex chronic illness. And the basic spirit of Capable is an assessment from an occupational therapist and a nurse for folks who are doing everything they possibly can to be able to remain at home, live well and safely. And those 2 providers come in and make sure that a person can live in that space in a functional way. And if there's things that need to be modified or addressed within that home, then they bring in a handyman, a home repair individual with some modest dollars and make that transformation alive and well for that person so they can remain in their housing stock. And if you don't know about Sarah Zanton and her model, I encourage every single person here to look it up. Capable. She just won the Heinz Award for 5 people in the country win this really awesome Heinz Award, and she was one of those 5 for her model. So check it out.
Right. Sure, I'm happy to. I think for me, I would hope that we will get to a point where our concept of health goes beyond physical health and mental health to get to a point where it's completely integrating and embedding the concept of social health and get us to a point where we've built networks of social care providers to be seamlessly integrated with care delivery providers so that we look at health from a holistic perspective.
This is always a danger of going last. I mean, I actually think that the vision in the AgeForward 2030 of the kind of community that is allows for a diversity of housing types, that allows for a community to build, that's not just about housing older folks, but housing the broad range of people in that community, is the kind of vision that I'd love to see. What's it going to take to get there? I mean, part of it's going to take, back to what you said, Tama, is it's changing not just state, local, and federal policy, it's changing all of our understanding of these issues. And I think there is an opportunity here as a baby boom generation sees our parents aging to provide us to all reflect on how we want to age. And I think as we think about that, we're going to think about those kind of communities that where we're integrated and where we have opportunities for a whole host of different types of housing. So I think I went big. I think it's a grand vision. But I think it starts with each of us up here recognizing what it is that we would like to have to be healthy, successfully housed and part of a community.
I think that's really achievable, though. I mean, that's something that we care a lot about the SCAN Foundation, and all the polling work that we've done about aging and caregiving and what people think about their own lives, what they think about family members' lives. The people who get aging the most are the people who've already seen it. Right. They're the folks who have been a caregiver in some way to somebody in their life, and that is the spark to get them to think about, what does aging mean for me? And so it's really doable if we take that perspective of really lensing forward from our own lives based on what we've seen in the process, things that worked and as well as things that didn't in our family member's life.
Yep.
That's a wonderful vision, and we'll come back in 10 years and see how we're doing. Okay, let's take a few questions from the audience. I believe there's a mic, yes, coming around.
Thank you for truly enlightening discussion and thoughtful. You know, one of my thoughts is a lot of the comments were about creating solutions that allow people to age in their community, in their own home, and to compensate for some of the loss of function that they have that doesn't necessarily mean they have to be in a setting like a nursing home or a hospital. But I also think we can go beyond that, so it's a comment, but I'd love your comments on it. Aging people who are losing physical capability, and even some cognitive capability, still can be contributors to their communities.
Very much.
Can you talk about programs you're aware of that are trying to keep them active and leverage their capabilities and that wisdom and their perspective? You know, we often think in companies about institutional knowledge. Well, they have tremendous institutional knowledge about society. Can you speak to programs that might also be addressing that as we're also keeping them safely in their community?
Sure, I'll start. I mean, I think just simply there are a lot of folks who are still working for a lot of reasons. Some of it might be economics, but a lot of it is also about social engagement. And so we shouldn't take that out of the equation when we think about the aging trajectory and living well in community. It may be transitioning from that job that they had for a long time and doing something more local, but that's a really present force. I think about things like in my community of Long Beach, whether it be the Oasis program that's inside of Cal State Long Beach, whether it is all the kinds of parks and recs programs that connect older people with younger people and mentorship programs. I think about the faith community that I'm part of that has a lot of connectivity from the older members as well as the kids and the teenagers. I mean, there's so many different ways for that engagement, and that brings life and vibrance to a community all the way across.
DC has a program where they're allowing businesses to register that they will support the older worker so that you can support them as well as an agency. I thought that was a really interesting way to keep people engaged in the workforce of all ages.
I was just in Germany last week looking at multi-generational co-housing models, and it was really built on that premise of saying each generation has something to contribute to the community. And we went to visit this one place, and one of the older, they're small. I mean, they had these. I think these work best when there are about 20 families, and so everybody knows each other and has a relationship. And we asked this one fellow about how it was working in practice, and he said, well, there's one older resident who was a carpenter, you know, as a career, led the building of this incredible gazebo they had in the backyard. He said none of us knew how to build it. It was like, you know, tongue and groove kind of construction, really beautiful. He said none of us know how to do that, but he did, and we all learned from him. So, I think it's maybe niche, but I think some of these multi-generational communities that allow for that kind of personal relationship and sharing have that potential.
I would also just throw in, though I'm just the moderator, that just the low
Right,
moderator.
you're just the moderator.
You're allowed to have
But
a
I
point of
think
view.
as we're thinking about the enormous caregiving needs that we're going to have in the future, the enormity of the population of older folks, no one is just a care recipient. We're caregivers in addition to needing things. So I think when I don't have a program example, but I think it's so critical to tap into that enormous human potential of this group of folks. And if Paul Irving from the Center for the Future of Aging for Milken is around, he will talk endlessly and beautifully about the importance of purpose. Another question from the audience? I can sort of only see a little. Here's one up here. Thank you.
Hi, thank you. It was a wonderful panel discussion. I am wondering, you talked about policy, and there are a number of aspects to the built environment who are responsible parties. So one that wasn't really touched on is the developers. And while we want to look at, modifying existing homes and communities and all that, we also want to somehow inculcate in the developers that this is important. And, I've been at AARP, we've been doing a lot of work in that space, and it's very hard to get the developers. They have a lot of competing interests. So, climate change and there are a lot of interests that are competing. How do we make aging populations, how do we lift that up, and how do we entice developers to engage in this space more thoughtfully?
I think there's a lot of policy structures that can induce the kinds of housing that we're talking about, and I'm sure you could speak extensively to that. One of the things I think a lot about is that developers build what people buy. That it's still about, at some level, of what the consumer demand is. And I think touching the point about how do we help people rethink what an aging trajectory looks like for them so they can lay out ideas about what it looks like to live well in a physical space over time has a potentiality for changing what it is that developers will ultimately create. Because if I have a Peter Pan mindset about my life, and I see the Peter Pan mindset that I'm never going to grow old, and so stairs and multi-level and garages that are way in the back, and all the kinds of crazy things that we see in development. If that's my value structure, then everything that I go towards purchasing is going to connect with that. So there still is that place. I'll tell you a little bit of story about redevelopment in my dad's house. He was going to be doing some work on his kitchen, and I said, while you have the guy here, can you have him look at the bathroom? And he said, well, why would he be looking at the bathroom? And I said, well, because the bathroom's on the first floor. And he, why are you doing that? And he's looking at me with that crazy eye, like, oh, it's going to be one of those Gero things again that she's talking about. And I said, well, that was the bathroom that was my bathroom when we were growing up. And there's no way you're going to get a walker or a wheelchair in that. Well, you can imagine how well that went over. But he looked at it with a critical eye of thinking about my grandfather, who had been in a walker with Parkinson's. And about 6 weeks later, I get this phone call out of nowhere. So I pick up my cell phone and I say, hi, Dad. And he doesn't even say anything about hello. He says, the guy's looking at the bathroom, we're going to redo it. Click. And I just, Mom, thank you, Mom's the word. But it's that he had to rethink about a house that he'd owned for 40 years differently about his aging trajectory in that house. And that changed what he was willing to do to it. So we have to do that on a macro scale relative to the development sphere.
Yeah, I think one other example, so we've, last year we've dedicated about $200 million out of our Treasury Department to invest in preserving and expanding affordable housing in our communities. And we've partnered with Enterprise, a community development financial institution, to help us administer those funds. And one of the conditions, if you want, for these projects to evolve would be developing health plans in those facilities. So we make sure that we're paying attention to the health and well-being of residents, particularly seniors in those places. And it takes extra work to roll up your sleeve and get those on paper and follow up on those. But this is an example of how practically you can make a difference in this space.
I don't know that I have much to add. I mean, I do think what Gretchen said is that if there's a profit opportunity, I think developers will come. And I think the issue is that a lot of what we're talking about is housing that we really need to address the affordability issue, and it's harder. So I'm actually going to point my finger at architects and designers who have to come up with, we talk about things like granny flats, retrofitting the existing building space. We have to come up with clever designs. So I think if architects can solve this problem, we're coming up with clever designs that builders can execute, the builders will follow.
I mean, and
all
I
on
think
you,
there's,
Tama.
I'm good with that. We'll end it with that. I mean, you know, developers, they care about the places that they design and help create in neighborhoods. And I think part of it is culture shift, right? Changing their attitude, having them sit at some meetings like this, understand, listen to how we want to live. You know, they care deeply about their communities of where they live. And I think, you know, twisting developers' minds and arms won't maybe take that much. I think we're close, and let's work together and figure out how to do that.
Well, thank you all so much. Please join me in thanking the panel and thank all of you for coming.
Thank you.